Thanks for joining us on this Sunday morning. On the show today, we are talking to Dr. Juan Diego Palacios. He's from the Diabetes and Endocrinology Institute at Renaissance. Well, thank you so much, Doctor, for joining us on the show today.
Thank you for having me today.
Yes. Well, let's start off by just talking a little bit about the Institute and what kind of services you provide to people.
Thank you for having me here. We are one of the largest diabetes and endocrine institutes in South Texas. We have a selected group of physicians, and then the additional resources that we have is not only when you go and see an endocrinologist, you see the physician, but you have a selected group of nurse practitioners, diabetes educators, researchers, and pharmacists, everybody in the same place, so you can see not only the physician, but the other resources that we have available for the population in general.
And that's great. And do you see a lot of people coming in? Do you see a lot of patients on the daily?
Yes, we have many patients coming to our center, not only for diabetes, but for other endocrine disorders. So we are able to take care of not only of diabetes, but any endocrine-related disorder that the population in general might have.
Now, diabetes is very known down here in the RGVL. It affects a lot of people down here. But also, we're discussing a little bit about osteoporosis. So can you explain to us what osteoporosis is?
Yes, of course. Osteoporosis is a chronic condition that is characterized by the decrease of bone mass. The decrease in bone mass eventually leads to fracture, and that's what osteoporosis is. In general, the bone structure is kept by multiple processes, a balance between bone formation, bone destruction, and the capacity of the bone to regenerate itself. As we age, we are losing that capacity, and that make us and put the patients at risk to develop osteoporosis and ultimately to fractures.
Wow. Now, what causes osteoporosis?
So osteoporosis is characterized by multiple processes, as we had discussed. As we age, we lose this possibility of the bone to regenerate. So aging is one of the main factors. And I would like to classify into what reasons, what are the causes of osteoporosis. So there's things that we cannot control. That is the genetic predisposition to have osteoporosis. Second, the ethnic group. Osteoporosis is more frequent in female population, Caucasian. And then third, the aging process. That's something that we cannot control. Then there's the other entities, is what we do to harm the bone, unhealthy habits, alcohol, tobacco, obesity, and lean body mass, and then the extra medications that might affect the bones per se. So those are the main risk factors for osteoporosis.
And is there like a certain age as to when someone should go in to maybe start being preventative for osteoporosis?
Correct. So as we age, we lose the hormones that actually are the key element for the bone formation. So as the female patients enter into menopause, we lose the hormones that are actually the key component for the bone formation. So female at menopause are at risk for osteoporosis, and they need to be evaluated, and men too, as well as they reach in their 60s to 70s, should be evaluated for this condition as well.
Wow, okay. Now this typically happens when people are aging and different, factors. Now, does this typically happen in children or teenagers, or is it something that you just start to be concerned about a little bit later in life?
Yeah, it's not frequently seen in children. There's only few conditions that might lead to osteoporosis in children. This is generally a process that happens in women that are entering menopause. However, if by any reason a female patient loses the capacity to produce the estrogen specifically due to a surgery, they had to remove the ovaries or something, that put that patient directly at risk of osteoporosis. And if that happened at early age, yes, that patient will need to be evaluated for osteoporosis.
Well, definitely. So they would then need to go and see a doctor just to make sure,
Correct.
they're okay. Now, what bones does osteoporosis affect? Is it the entire body, or is it just certain areas?
So the osteoporosis has a specific selection for certain bones in the body, specifically the trabecular bone. Where is the trabecular bone located? In 3 specific sites. 1 is the lumbar spine, number 2 is the hip, and 3 the femoral head. Those are the 3 main sites that osteoporosis affects.
Okay, now what would you tell someone who may be in the age range where it could start to affect them, or they may fall into one of the factors? What would you tell somebody if they were too afraid to go to the doctors or to get checked out?
Yeah, specifically, there are certain recommendations by the medical societies of when a patient should be screened. So those recommendations are: female at age 65 should have a DEXA scan, that a bone densitometry that should be done every 2 years starting at age 65, and male at age 70. However, if a patient has risk factors, meaning chronic use of steroids, obesity, and have a family history of osteoporosis, those patients should be evaluated sooner. Age 50 to 75, if the patient has some risk factors, those are the type of patients that should be evaluated sooner by a physician.
And what are some symptoms that people should look out for, and then when should they start to go seek a doctor?
Yeah, that's a really important question, and that's what I wanted to convey to the public, is that osteoporosis is normally a disease that doesn't have any symptoms.
Wow.
We don't have any symptoms, and if it presents with symptoms, it's usually too late. It's a fracture that happened in those places that I have discussed. So it's important for the population just to have a general awareness of prevention and what we can do to prevent this condition to happen, in order to, because the complications when the disease is presented are really difficult to treat.
Definitely. So they should go and get screened if they fall in that age range or they fall in one of the risk factors. Now, where can they go? Is there a number that they can call or a website they can call go to?
Yeah, we are open to any consults for the patients. We can see them in our center, and the phone number should be coming up on the screens, and then we're more than happy to see them whenever they decide to come.
Definitely, and they can come and see you. Since you are new to the Valley, they can come and be your new patient.
Yes, correctly. We're open to any consultation for the public and everything.
Great. Well, thank you so much, Dr. Palacios, for coming here and talking to us a little bit about this, and raising awareness right here in the RGV. We appreciate it.
Thank you very much for having me.
All right, thank you so much. Well, when we come back, folks, we're going to be talking to the boys in blue about back to school safety. Stay with us.